Hi, my name is Derrick Siebert. I'm a diagnostic and interventional radiologist at Radiology Associates of Wausau. What I liked about radiology was that I feel like it's head-to-toe medicine. We do everything from head CTs to toe x-rays on everybody from people before they're born to people, as they're quite elderly. I received my education first bachelor's degree at Michigan Tech in Houghton, Michigan, and then I went to Milwaukee, Wisconsin for med school at the Medical College of Wisconsin, and then over to the Twin Cities at the University of Minnesota. I completed an internship, followed by a residency in radiology, and then followed by a fellowship in interventional and vascular radiology. My specialized area of focus is vascular and interventional radiology. We use X-ray video cameras to guide procedures, to put in stents, to guide catheters for targeted chemotherapy, to do biopsies. It's all minimally invasive procedures using imaging guidance. I chose that specialty because I felt like we can do quite a large number of procedures through a small pinprick. Basically, we can, deliver targeted chemotherapy or biopsy an area of the body that would be very difficult to get at surgically, and the patient, for the most part, usually can walk out the same day or the day after with just a tiny pinprick of a wound. And I thought that was really at the cutting edge of medicine, and that I had a skill set that could, allow me to deliver that kind of care. Central Wisconsin has a lot to offer as far as a good place to raise children, a nice place for outdoor activities, and it's not too far away from other metropolitan areas if you need to go to one for any particular reason. I think the area is safe. It's my home. I grew up here, so I'm familiar with it, and I think that, it's a wonderful place to live. The thing that I like most is when I have a patient who comes in who's nervous about a procedure, and I usually, try to talk to them ahead of time and tell them that it's not going to be very painful, or, that it's going to be over kind of before they know it started. My favorite part at the end is a lot of times when they say, "I didn't even know that you began and now you're already telling me you're done." I think that's kind of neat that we can do so many things minimally invasively, and kind of allay patients' fears of, pain and problems after the procedure. A great day at work is finding a tumor or an infection at an early stage so that a patient can have effective treatment and potentially get a cure, as where they otherwise would not be able to if it was found later on. The breadth of knowledge that we have among the entire members of our group means that we can provide pretty comprehensive patient care here at Radiology Associates of Wausau.